Hello everybody, I'm Greg Stock. I'm the CEO of Thibodaux Regional Health System. It's my pleasure today to have with me Dr. Chad Dugas. Dr. Dugas is an interventional cardiologist and a very good one, and we want to talk about that for a few minutes. Let's talk for a second or two about what is an interventional cardiologist? What differentiates them from another cardiologist?
Sure. So an interventional cardiologist is a cardiologist that performs non-invasive procedures. And it's typically something that will treat the heart. Almost all cardiologists can perform non-invasive procedures, such as an angiogram. A lot of people are familiar with what an angiogram is. It's where we go into the body with catheters, take pictures of the heart, the arteries. But not all cardiologists can treat the disease that they may find in the heart and in the arteries. So interventional cardiologists will typically focus in three areas. Some focus in one, some focus in all three. That being, some treat just blockages in the heart. We treat blockages in the legs, the neck, the belly, the kidney arteries. And then some cardiologists or interventional cardiologists will now also perform what we call structural heart procedures, where they'll work on the heart valves and do some other work inside the heart chambers. I myself, I'm trained in coronary procedures, so I will work on blockages in the heart, and I'm also trained in peripheral procedures, so I'll work on blockages, legs, neck, etc.
Very good. Well, those problems plague a lot of people. One of the kind of growth areas, or areas where there's been a lot of expansion of that expertise using technology, is the peripheral, meaning like the legs. Somebody has poor circulation in their legs. Why don't you describe that, what you can, sort of things you can do there?
Sure. There's a lot of different things that can be done in the peripheral circulation. And in our population in particular, we have a lot of patients who are diabetics. We have a lot of patients who smoke. And unfortunately, those are the two biggest risk factors for development of PAD, or peripheral arterial disease. We also see quite a high bit of patients with something that we call CLTI. And what that stands for is chronic limb-threatening ischemia. These are patients that are developing wounds on their feet, wounds on their legs, necrosis of certain tissues. And in those patients, we really need to revascularize them very urgently, to be honest with you. And by revascularize, I mean going into the body again with catheters, but not just catheters. We also want to use other technologies that we have at our disposal now. We also have something new called IVL, and that stands for Intravascular Lithotripsy. It uses technology from lithotripsy of breaking up kidney stones, but it put it into a balloon. So a lot of the disease we see in the legs is very heavily calcified. And what this does is it allows us to treat the blockage with a balloon technology, but it also allows us to deliver these lithotripsy pulses to disrupt the calcium. And then after that, we're able to better treat the area, whether it be with just a plain balloon afterwards, or a balloon that we call a drug-coated balloon, which is a balloon that has a drug on it to prevent the vessel from developing more blockage. So we've got a lot of tools at our disposal. And nowadays, we work more and more in what we call the below-the-knee arteries, or in the smaller arteries, particularly in our diabetics and in our patients with limb-threatening ischemia. So there's a lot out there, and there's a lot more to come.
That's fascinating stuff. You do a lot of good. You've done a lot of good, let me put it that way. And we're happy to work with you here at Thibodaux Regional. We look forward to working with you further, and for these type of things, we want to, as I said earlier, delve into some details. Thank you again.
Absolutely. Thank you, Greg.